It's 11:01 a.m. now, so I can suggest we can get started.
Yeah.
Again, I just heard about notes about the survey. I'll just repeat too. I'll mute everyone shortly, and you're welcome to submit questions either via the chat or to unmute near the end when we'll have a bit of a Q&A regarding the content. Again, our guest presenter is Rica Esguerra. She's from Right at Home Canada, and that's an organization that provides in-home services to seniors and to adults with disabilities. And she's talking about home care. And I believe, Rika, I will turn it over to yourself.
Wonderful. Thank you so much, Colin. And good morning, everyone. It's nice to be back here. I see some familiar faces and I recognize some of the names. So thanks again for having us back. Um, just wanting to make sure you can hear me okay?
Yeah.
I
And you
can
can
hear
see
no
me
problem.
perfect. Excellent. Just a brief introduction about myself. I'm the National Director for Community Engagement with Right at Home. I have been working in the home care space for over 18 years, particularly in the space of strategic partnerships, fostering, creating strategic collaborations with organizations to improve the quality of life of those we serve. And today it is my absolute pleasure to share with you some information about funding options for home care in Canada. So Right at Home created this guide amalgamating public information. So nothing here is you probably have encountered some of it. We've amalgamated everything just to make it easier for individuals, families, like yourselves when making an educated decision regarding home care. So that being said, let's get started. You've met my colleague yesterday, Karen Platt. Karen is our director of operations for in our corporate department. And she gave you a little bit of information about Right at Home. So allow me just to refresh your memories about where we're from. Right at Home is one of the largest and most trusted providers of a comprehensive suite of supportive care services for people with disabilities, those that are injured, and aging clients globally, delivered in-home or wherever home is to them. We are present in 8 countries, over 680 offices all around the world, and over 30 years of home care experience. We are a fully Canadian company. Our headquarters is in Burlington, and we have been servicing our Canadian communities for correction, I said yesterday, 12 years. Now, looking back, actually, it is 13 years. And we have offices in Alberta, BC, Ontario, Manitoba, no, New Brunswick, Nova Scotia, and PEI. So what is home care, right? So you've had an introduction yesterday, but just for the purposes of our conversation today, let me emphasize on the full continuum of care. So not all home care services are created equally. Some you would encounter only provides wellness services like wellness check-ins, companion care, homemaking. Some provides personal support or physical assistance, while others provide nursing therapy, and end-of-life care. So with Right at Home, we provide a full continuum of care. So we'd like to refer to it as non-medical to medical and anything in between. So when looking at a home care organization, you have to ensure that you're asking the right questions with regards to the type of service that you're looking for. So why in home care? We've looked at statistics and found that these are the primary reasons why people are preferring to age in place. Age to age in place, to preserve dignity, monitor change more efficiently, fall prevention, socialization, and having that peace of mind. But simply put, home is where the heart is, and it is where we are most comfortable and where our memories are. So the million-dollar question, what is the cost of in-home care? Right? So I can give you a range of a cost of home care because it's a moving target. Home care costs vary from region to region, and unfortunately, there's not really an information out there that's going to provide you with a direct answer unless you call around. However, it is my goal today to provide you with a formula that you can use when trying to make a decision with regards to, what type of care do I want for myself or for my loved one. So as an example, A range for home care services, so meaning this could be companion care or personal support care. It could range from between $36 up to, I would say, $46 hourly, and that depends on the type of care required, right? I know that's a big range, but that ranges from companion care, homemaking, personal support, and also we have to keep in mind specialization in care, right? So if you're looking for a slightly more specialized care, that means more training for the personal support workers. So that's probably on the higher end of the scale. When it comes to nursing care, a good range would be about $50 hourly up to $80, and this is for LPN or RPN care. If we're looking at registered nurses, that could go up to, I would say 100, 110, really just again, depending on the specialization and depending on the type of care required. So this chart here that you're looking at, this is based from Sun Life Canada's cost of care by province, which was published in 2022. Now, you're probably wondering why I'm giving you data from 2022. I'll leave you to it to collect the most up-to-date data for 2025. What I'm trying to do here is I'm just trying to provide you with a formula on how you can calculate your cost of care when you're trying to make a decision as far as what is right for me, long-term care, retirement home, or home care. Okay? So to get your cost of care, you would need to divide your long-term care hours or retirement home hours by the cost.
Here is.
Oh, sorry, did someone have a question? Okay, so to get your cost of care, you're going to divide your long-term care home hours or retirement home hours.
Just plug into this because when the time comes, you know, to do the survey.
Okay, may I continue? Is everything okay?
Everything is fine. Go ahead,
Okay.
Rica. Yeah.
So dividing the long-term care home or retirement home monthly costs by your care per hour. So as an example, let's take Alberta. In Alberta, your monthly co-payment for long-term care is $2,249. We're going to divide that by the care per hour in Alberta, which is $38. That would give us about 59 hours of home care per month. Example number 2, in Nova Scotia, retirement home monthly co-payment or monthly cost is around $48.50. We divide that by the hourly cost of home care in Nova Scotia, and that's going to give us 134 home care hours per month. So this provides you just a good baseline with regards to, do I want to move to the next level of care, or can I age in place? Because oftentimes the question is, if you have the right supports, you can typically manage chronic conditions safely at home with the enough home care hours, right? And we have to keep in mind, we can use combination of government funded hours versus insurance covered hours and public and family funded hours. So we're going to talk more about that and how you can coordinate all those benefits and make that work to your advantage. Okay, hang on, my slide's not moving. Okay, so here are the funding options for home care. We have separated the funding sources into the following categories. So we have government funded care, family funded or out of pocket, health benefit insurance, other insurance, tax credits and benefits, and federal workplace benefits. So let's talk about the first one, which is government funded support. So I've listed some examples in here. We can further break down government funded supports into 3 categories. That is provincial, regional, and federal. So the first one is provincial. In our case, because this is for Ontario, we have the Ontario Health at Home. I've listed some examples for out of the province as well, if you have family out of the province. Regional, we have a homemakers program. It really just depends on where you live. Sometimes you have it, some regions they don't. And then the federal, of course, which is the Interim Federal Health Program or IFHP. So let's go back to provincial, which is Ontario Health at Home. I know we've already covered this yesterday, and you have some ideas as far as what Ontario Health at Home covers. It is often, provincial programs are often fully covered. In Ontario specifically, it is fully covered. However, in some provinces, it might be maybe income tested and it might involve a copay. Also provincially, we have disability supports. Each province have their own disability program. In Ontario, we have a passport program, self-managed program, and all of that. And typically, the funds are either sent to the client or their family, and they manage and retain the services. Or they would note which provider they want to work with, and that provider can directly bill the insurance. When it comes to regional programs, such as the Homemakers program, like I said, it's typically income tested. And even if you're already receiving services from Ontario Health at Home, you may still be eligible for the Homemakers program if you fit the eligibility requirements. So as an example, you can be eligible for homemaking services. Homemaking services can range from anything from meal preparation, support with laundry, support with getting your groceries. And we've seen hours that are approved between 1 to 4 hours. So it really just depends on the eligibility requirements per region. Interim Federal Health Program, or IFHP, this is a temporary program offering temporary health benefits for temporary residents of Canada, such as refugees. So they're also entitled for coverage for hospitalization, foot nursing, personal support, and home care visits. Okay. So the next one is family funded or out of pocket, and this is the most common one. So when we say funding options for home care, our minds either go to government covered services or family funded or out of pocket. But typically when we say family funded, we always think of, oh, I'd have to tap into my savings, right? So we've listed some examples in here on what may be considered as family funded or out of pocket. So of course, general savings top the list. If you have any registered savings plans such as RRSPs or RDSPs, those can also be utilized to funding for your care or funding for a care of a loved one. There's also the pension income or dividend paying investments. So dividend paying investments, these are the type of investments that produce cash on a monthly basis, which can offset the cost of home care and other things such as home maintenance costs. If you are, downsizing, the kids are grown, they've moved out, and you want to downsize from a bigger home to maybe a smaller home, condominium, if you have an investment property that you want to sell, home sale or asset sale can also be utilized to fund for your care. The next one is my absolute favorite because sharing is caring. We've seen with some of our clients cost sharing among family members. For as an example, siblings, everybody pitch in to fund the care for mom or dad, or family members pitching in to support a loved one. Reverse mortgage is not so common, however, it is becoming more popular these days. And reverse mortgage is a type of loan that allows homeowners to borrow against equity in their home. So the security, the home serving as a security for the loan. So unlike traditional loans, you don't have to repay the amount borrowed. The loan is repaid when the homeowner no longer lives in the home. So as an example, when the owner passes away. Now, you have to remember that you are responsible for the interest and fees that are added onto the loan balance. And also, because you're still living in the home, you still have to maintain your insurance and all of that. And then finally, rental income. Depending on where you live, there are some city bylaws where you're allowed to actually build something in the back of your property, depending on how big your property is. Or if you've purchased an investment property and you're renting it out, rental income can also be considered as a family funded or out of pocket way to pay for your home care. I do just want to share. We have worked with this one organization. They're called Garden Suites. I think you can look them up. And they basically customize like a modular home in your back. It's really nice. And it's one way of aging in place. So if you prefer to just have like a small place for yourself, you don't really want to deal with maintaining a larger home and you want your family members to utilize your main home, but still have your own privacy. They are building, like smaller homes, like tiny homes, in people's backyard, and they could either rent out their primary residence or have their family live in it. That way they could still have, support, and still maintain some privacy. Okay, so let's talk about health benefit insurance. Health benefit insurance, this is insurance offered by your employer to active and in some cases retired workers. Generally, benefits include your dependents, such as your spouse or your children. And we've listed some definitely this is not an exhaustive list, but we're just listing some examples, and it might inspire, some ideas. Oh, hey, we have this, right? So typically you have insurance providers like Sun Life, Manulife, Canada Life. In some cases, depending on your workplace, you have specific benefit plans. So as an example, if you've worked in the auto sector industry, General Motors and Chrysler, they have a specific benefit plan. Active teachers, retired teachers, and I think for Hydro One, you have your own too, right? I'm not very well versed with it, but I think you guys do as well. For active service, RCMP, Canadian Armed Forces, and for our retired veterans as well. Dependent benefits. So dependent benefits, this is a type of insurance. It's not very common. However, in some cases, it may be available depending on your plan. Dependent benefits is something that covers your dependents. So as an example, you have a wife that's needing care, so the services, the benefits go to her instead directly to you. Or let's say you have children needing extra support. And then finally, employee assistance program. Employee assistance program is not necessarily a funding option per se. Employee assistance program is a workplace benefit that aims to support employees to function to their full potential by alleviating the stress and other challenges that may impede work. So typically this includes mental health support, therapy and counseling, and depending on the employee assistance program, some of them would provide a navigation component. So as an example, we've worked with some case managers from employee assistance program where they're amalgamating all the options and they're presenting those options to the member. And it's up to them to make a decision. And if they so choose, let's say they chose right at home, they would be signing a contract directly with the provider, and they would be funding for their own care. In some instances, employee assistance program may also cover for the cost. So we've listed them on here, but I would, take it with a grain of salt, if you will, because not all employee assistance program do pay for the services itself. Okay, so we've narrowed down some tips when calling an insurance provider. So just ensure that you have your benefit card or past healthcare claim, which includes your plan number and ID number, because they will for sure ask for that. Ensure that the insured member or POA is available to give you permission to disclose information. So disclose information. So as an example, if you're calling on behalf of a member, that could be your spouse, make sure that they are there to give you permission to disclose information. Explain to the insurance provider the type of support. If you're looking for home care, then say it is for home care and the type of home care services. So if let's say you're looking for personal support, because language varies. And with some insurance providers, you say personal support, they call it differently. It could be home support or under home care. So make sure that you are you don't have to, I don't want to stress you out because I don't want you to think like, oh, I have to have the right language. But at the same time, just make sure that you describe it and they should be able to guide you as far as providing you with the right benefit information. So personal support, nursing care, foot care, and all of that. Also ask if there is a per visit or per coverage, per day coverage amounts. Yearly maximums, definitely good to know. Ask if these benefits are combined with any other service provider. So as an example, this is what you call coordination of benefits. So as an example, I have a daughter who's type 1 diabetic, and we receive funding from ADP. So a portion of her insulin pump is being covered by ADP, and then a portion of whatever is left we submit to our insurance provider. So when I'm filing a claim for the insulin pump cost that is not covered by ADP, I put on the claim, a portion, whatever is covered by ADP, and I only file for the claim that is not covered. So that way, it's like your insurance providers talking to one another, and they can coordinate what they would be paying for. Okay, where were we? Ask if there are yearly maximums following a calendar year or a different benefit year. As an example, many teacher plans start July 1st rather than December 1st, just so you can better plan. If you're already maximizing your benefit amount, you can kind of be prepared as far as, like your co-payment deductibles and all of that. This is really important. Ask if a physician referral is needed or an assessment. So typically a physician order, a nursing assessment, an OT assessment. Ask if those are required. Ask if the plan will pay for the service provider directly. In some cases, so as an example, we can bill some insurance providers directly, and that would eliminate some of like the stressful claim filing on your end. Think of it as when you visit a dentist. I'd rather go to a dentist who can file the claim directly than leaving me with the paperwork. Also ask if there is a waiting period. We're going to talk more about that in a little bit. Ask if there is deductible or a copay. So a deductible is the amount you incur before coverage will be considered, and a copay, it's the 80-20. So typically insurance pay 80% and you pay the 20% as the member. All right, so I can't see you and feels like I'm talking to myself, so feel free to unmute if you have any questions. So I'm going to move on to other insurance. I've separated them. On my left side are the more common ones, and on the right side are the not so common ones. So on my left side is auto insurance or MVA insurance. So motor vehicle insurance would be if you were in a motor vehicle accident, your auto insurance may cover medical expenses, attendant care benefits, and loss of income. And your workplace accident insurance, WSIB, in some provinces, they're called WCB. This is a form of insurance that protects employees from injury or disability sustained while performing a job. So benefits include, but are not limited to, wage replacement, medical rehabilitation, and return to work support. Now, on my right side, these are the not so common ones, but you're likely familiar with them as well. We have long-term care insurance. Long-term care insurance is a paid insurance policy. So just like when you buy your life insurance, long-term care insurance is something that you would buy specifically for long-term care, retirement home, or home care. Now, I did say in my previous slide, ask if there is a waiting period, and that typically applies for long-term care insurance. So you have to, it's just best to be aware, what's the waiting period? Is it 30 days before insurance kicks in? So then you're liable for the first 30 days of the amount. And they usually also have like a cap per day, not fee, what is it called? Per day, coverage. So it's best to just explore that with your insurance provider to ensure that you're not going over that amount. Now, whole life insurance is a type of life insurance. So unlike, like we have the term, I'm not an expert in insurance policies, but I will try to answer all of your questions as best as I can. Life insurance, so we have the term life insurance, which typically expires, like you have a limit of 20 years, 30 years, and you have the whole life insurance, which is covered, for as long as we're living. And typically it also has a cash value component to it, like an investment portion, and that investment portion you can borrow against from. And you can typically utilize that for any needs. Some people like to keep the investment, and then when you file a claim, you can collect the the family members or the beneficiaries can claim the death benefit as well as the investment component. Some people are utilizing that investment component for care, funding their care and other life changes. Critical illness insurance, this could be a separate policy or it could be a rider to your life insurance. And this is a lump sum benefit for individuals diagnosed with a serious illness, and it may be used to support a client during their recovery or treatment. And that may include your personal care and nursing support. And then finally, your disability insurance is a purchase plan that generally includes wage continuance in the event of a person's disability. Okay, so I'm going to move on to tax credits and benefits. I know some of you had questions about this yesterday, and I said we're going to go over it today. This is definitely not a full listing, so please check with your accountant or CRA for more information. But I've listed the more common ones here. So the medical expense tax credit is a tax credit that applies to medical expenses and medical supplies, dental care, personal care, and nursing care may be included in that. Disability tax credit for individuals with prolonged or severe impairments, or if they're supporting a family member with disability, they may be eligible for a non-refundable tax credit to reduce their tax bill. So the disability tax credit, though, you need to have a certification from a physician. They typically would complete the form before you can claim for the DTC. Now, the Canada Caregiver Credit, or CCC, this is a benefit if you are a caregiver taking care of your spouse, common law partner, or an eligible dependent with physical or mental impairment. You may qualify for this tax credit. But for eligibility requirements, please visit the CRA just so to ensure that you are qualifying for these tax credits. EA benefits is more on the more common ones that we are aware of. So if you are eligible and taking care of a critically ill or palliative family member, you may qualify for this type of benefit. And it provides you up to 55% of your income with a weekly maximum of $650. And then finally, Ontario Seniors Care Tax Home Tax Credit. This is a tax credit designed to assist low to middle income older adults with expenses that enable them to live independently. So the eligible expenses coincide with the METC, medical expense tax credit, and it can be claimed along with your METC. You may claim up to 25% of your eligible medical expenses, up to $6,000, with a maximum credit of $1,500 annually. So please check the CRA or consult with your accountant for more information about those. All right, so let's talk about federal workplace benefits. If you served in the military, Canadian Armed Forces, there is attendant care and home assistance. So attendant care is similar to personal care, whereas home assistance, that refers to like housekeeping, grounds maintenance, and typically a medical assessment is required for both by a qualified practitioner. Now, for our veterans, for our active Canadian Armed Forces and RCMP nursing visits, they can be covered under Program of Choice 8. And under treatment benefits, this is administered by Medavie Blue Cross. It covers home health nursing for eligible persons, including nursing assessments, home visits, and foot care. And then finally, we have the VIP program, or Veterans Independence Program, again administered by Medavie Blue Cross. This program aids eligible veterans in maintaining independence through services like personal care, nursing, foot care, housekeeping, ground maintenance, meal prep and delivery, and transportation. Okay, so when you're choosing for an in-home care provider, just wanting to give you some tips, look for the following. So ensure that they have a liability insurance, that they do background checks, especially VSS, because we are caring for people, right? To ensure that they're not just doing the regular police check, but the vulnerable sector screen check. Education and expertise is also very important. So if you are experiencing a specific medical condition such as Parkinson's, ALS, dementia, it's good to know that there are organizations that are actually specializing in those, because specialized care can make a difference. Also, if you're engaging with like an independent contractor, like a private caregiver, you'll have to ensure who's doing the payroll, taxes, and insurance. I apologize, my computer says it's low in battery, but give me 1 second, please.
We can see and hear you fine there, Rica, no problem.
Okay, just
You
give me
need to,
1 second. I think I just need to plug it in.
okay, take your time.
I apologize. I thought I plugged it in, but I guess I plugged in my coffee maker instead.
All
Um,
good.
okay, so where were we? Payroll and taxes. So you have to ensure, just good to know who's paying for that, who's doing that. And then finally, your care oversight. And this is typically having a nurse case. So a care oversight is typically done by a care manager, and they are typically nurses or social workers. It's good to have a care oversight because your care plan is a living document. So when someone does your assessment, it's not one and done. Your care plan is a living document and should be updated regularly because there are changes in our health, right? So care oversight is really, really important. Okay, so these two documents, no need to take a screenshot because I'll be sharing with you the ways to pay guide booklet, and you should have this. And it's just a guide when choosing the right home care provider. So important questions to ask when you're choosing the right home care organization and what type of help does your loved one need. So it's just a good checklist. We're making an educated decision when it comes to home care. And then finally, since we are in the topic of funding options for care, I'd like to share a little bit of an update. So this is something new with Right at Home. We just recently launched our Right Care program, and this is an effort to support individuals, families with a blended care. Let's face it, sometimes even with the coordination of benefits, home care can still be very expensive. And with the right blended care, sometimes it can offset some of the cost because you're going to have the technology sort of passively working in the background. So if you'll allow me, I'd like to share a little bit of information about that. Just wanting to share current statistics in our healthcare landscape right now. Oh, sorry, it has a life of its own. So this is not new. I think we all know that most Canadians want to age in place for as long as possible, ringing at 91%. However, 1 in 10 patients extend their hospital stay until home care services or supports are ready for discharge. This is actually one of the indicators that adds to emergency department overcrowding and our strained healthcare system. And out of the 340,000 older adults at risk of frailty, here are their top 6 medical conditions: hypohypertension, cardiac and vascular, nutrition and wasting, infection, renal disease, movement, and immobility. So if you take a look at this, these are chronic conditions that can be safely managed at home with the right supports. So we thought, okay, it's not advancing. Okay, there you go. We thought, how can we improve the statistics? So we looked into various technologies, and there are many emerging technologies in the healthcare space. However, only a select few truly integrates with the system. So we found Sensi AI, who is our technology partner, and it really demonstrates how a true integration of the human care and the proactive care technology can help augment those statistics. So we bring you Right Care Plus. So just to give you a little bit of a background about what that is, so this is the Sensi system. Like I said, it's the technology, our technology partner or co-pilot. It comes in 3 pods. It's like those little air fresheners, 3 pods that you plug into wall, typically bedroom, like where you frequent your home. So bedroom, bathroom, and kitchen. It is a 100% audio-based system, no cameras, no motion sensor. It's just audio. And it takes about 5 minutes to install. You plug it in, and then that's it. It has its own router, so it's not dependent on your Wi-Fi at home. And what it does is it's triggered by key phrases, sounds, and key phrases. I'm missing one thing. Key phrases, words, and sounds. of care-related and healthcare-related events. So as an example, coughing, it detected, the coughing has increased by 250%. It's gonna alert the dashboard, and we have different kinds of alerts, like high-level alerts. So think of it as good to know and emergency, like we need to act in this now. So it gives us that report that enables us to provide with proactive action. So what this does is, it's able to blend in, the caregiving, the human component, and some like a technology that's working passively in the background. It's like having 24/7 care. No, I'm not going to delve further into it because we have very limited time. I just want to share you some exciting news about it. Categories of high alerts, we have falls, safety concerns, call for help, and EMS. All of that goes directly into the dashboard. But this type of technology can actually detect over 100 insights in care events. I've listed some examples in here. They're definitely not all of them. But one thing is, UTI and falls are the biggest factor that we end up in the emergency department. It can also detect, a bunch of other things. So this technology is currently exclusive to Right at Home. Currently, there is no direct competitor to this type of technology. It's a non-wearable. So keep in mind, there are other technologies in the market, but for this type of technology that's audio-based, working passively in the background, it's something new. It's the flexibility. It may be installed wherever home is to you, or to your loved one. It's cost effective, no additional fee for the dashboard monitoring. It becomes standard of care for us. It's an intrinsic part of our care team, combo of high touch and high tech, providing revolutionary care. It's always on, working passively in the background 24/7, providing insights. It's proactive. It has proactive and reactive care capabilities. It's 100% audio based and can detect 100 care events up to 95% accuracy rate. And unlike cameras and motion sensors, it has a wider detection system in the home. So no live video, and it provides more context. So I'm just going to play this. The sound isn't working, but just to give you a little bit of an overview of how it works.
We can see the video, but just can't hear anything.
Yes, unfortunately, I can't make the sound work, but it's a 30-second video just to show you how it's installed in the home. Perfect. And with that, I'm going to close with any questions. I'm going to stay in for some questions or comments. And thank you so much for having me today.
Thank you, Rica. We really appreciate the comprehensive presentation. Hey, folks, I'll start off with maybe one question I had. ADP, you mentioned in the presentation. Am I right? That stands for Assisted Devices Program, a program that pays, I guess it's provincial, that pays for a portion of certain medical devices that a person might need, like hearing aids or wheelchairs.
Correct. Yes. Yes. I noted that example because I have a daughter who's type 1 diabetic, and we work with coordination of benefits between ADP and our insurance provider.
Very good. Very good. Yeah, I think many of us are fortunate enough to have post-retirement benefits in this group here. So we've had some practice dealing with insurance companies over the years.
That's wonderful.
Yeah, for good and bad. Does anyone else have any questions? Wanted to ask anything?
Rika, I have a question. In order to qualify for the home care, you have to go through the process, like be in the hospital, and then before going home, you get the CCAC coming in. That is the only time this home care program comes into effect, or can you do it on a personal basis? Say you want some help at home for your spouse.
Oh, absolutely, Nazma. You don't have to go through, those channels necessarily. If you wish to, you certainly can. You can actually self-refer to Ontario Health at Home. You can make a self-referral. At the same time, if you are looking more for like a top-up care or to bridge that gap while waiting for the government-funded care to kick in, you can certainly engage any home care organizations. You don't need a referral. You just typically, I can only speak for Right at Home, but typically we would start with a phone call. And it's just an assessment, and then we can have our care planners go into your home, just to have a chat, just have a good understanding of what is needed. And then we present you with a care plan. If you're happy with that, and if you want to move forward, then we have a service agreement. It's not necessarily a contract. It's more so just information of, liability, like expectations and all of that. But you can cancel within, I believe there's, I don't recall our notice of termination, but if you want the services to stop, you can certainly just give us a written notice. It's not a contract per se.
Thank you.
Yeah, welcome.
Anybody else have questions?
Yeah, I had a question.
Go ahead.
I'm Marilyn McLaughlin, Doug's wife, and my question was about cameras in the house. I know you talked about the sound, the Sensi, but do you have any experience with people using, we have known people that use cameras to watch the caregivers in the house remotely. Do you have any advice on that? Do you recommend it, or are the companies allowing that, and how much does it cost? Do you know anything about that?
I'm not too familiar with the cost. It's something that we definitely looked into, but when looking at technologies, we wanted to look into something that's not invasive. And so typically for anything like that, there has to be a consent, right? So if you have some sort of monitoring device and you're engaging a caregiver, I think it's just good practice to let the caregivers know that, hey, this is installed, just so they are aware. With the technology that we chose, which is Sensi, which it is fully audio. And one thing we like about it is that it picks up and it triggers. So it's not like it's not like a baby monitor, or it's not like Alexa or Google Home that you can talk to. Think of it sort of like a sleeping robot in the background. And then once it hears like keywords, phrases, and sounds like a loud bang or someone calling for help, 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 then it's gonna pick up, like its ears gonna perk up. It's gonna pick those up, and it's going to alert the dashboard. And then we follow a triage plan. So as an example, if somebody falls, our triage plan would be call daughter. If daughter doesn't pick up, call 911. So something like that. I hope that answers your question.
Yeah, thank you.
You're welcome.
Maybe just a little bit on that. I remember my mom had a Philips Lifeline. That was a device she wore around her neck, and it could detect a fall. And then if it did detect a fall, it would call her. And if they couldn't connect with my mom, they would call the caregiver, sorry, the neighbors that were alternate contacts, and if they couldn't get a hold of them, they would call 911, and it was very helpful. And a few times we needed it. So I'm getting the sense, am I getting the right context that Right Care Plus is sort of like a maybe a variant, but a more powerful or a more advanced service like that, that instead of depending on a physical device around your neck, it depends on listening to sounds and interpreting them and making actions accordingly.
Yes, absolutely. However, I would say that it complements, like a pendant device, like a lifeline. We
Okay.
certainly encourage, if, someone's wearing a lifeline, if they want to keep it, they're more than welcome to, because Sensi is more on the proactive side of things, so more on the insights to prevent a fall from happening. Although it has some reactive capabilities, like, detecting falls and all of that, it's really the pros of it is more on the proactive sides, the key insights. So as an example, it detects, let's say someone goes to the bathroom too frequently. It has, those algorithms and anomalies that it detects, and it compiles them into potential care events. So it's never going to diagnose someone with Mrs. Smith has UTI. It's just going to say potential UTI. So it's going to prompt our nurse supervisors to call our client and say, hey, we've noticed, there's an increase in toileting or increase in coughing. Maybe we should book an appointment with a primary care. So it's more on that. However, it also has the benefit of the reactive care capabilities, such as emergencies, call for help. I just want to cite, I want to be mindful of time. Okay. I just want to cite an example. So we have a client, she has severe dementia. And so the caregiver comes within a certain hour. But oftentimes when the caregiver comes in, she's already agitated And, you know, like we couldn't figure, so when she's agitated, then the caregiver becomes stressed. And before Sensi, we couldn't figure out why that's happening. So with the installation of the technology, we figured out that between the hours of, I think it was 2 or 3 hours before the caregiver comes in, this client has been calling for help, 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 and she's already wet the bed. And you know, like if she's uncomfortable, obviously when the caregiver comes in, she's gonna be agitated. So what
Mm.
we did with the insight, we were able to shift the optimization of the care plan, and put in the caregiver when they're needed the most. So then before the actual event happens, we're more on the proactive side versus the reactive side. And let me tell you that that improved.
So you
Um,
changed the hours of visits to
Exactly.
address
Yeah,
when she needed the help most. Yeah.
yeah,
Okay.
exactly.
How much does the sensing system cost?
So the Sensi system, I can share with you, this is totally new. We just launched this March 15th. I only have our costing information for retirement homes and our long-term care home partners. If you allow me, if I can just circle back, because we also have 57 offices, and they're all in different locations. I could probably come up with, would you say, majority of your members are within the GTA? Just so I'm aware of
Yes,
pricing. Okay.
that's correct.
I will circle back and provide you that information.
Thanks, Rica.
One of your slides mentioned that you have these services in 8 countries around the world. Which are these 8 countries? And is the head office in Canada?
Yes, our head office is in Burlington. You're going to test my knowledge. Okay, I'm going to try to
No,
answer this as
I
best as
found
I
that very
can.
interesting.
Yes, of course. So we have Canada, England, Ireland, US, Japan, Germany, I think. And I'm blanking out on the other two. But yes, that's also something that I can circle back.
No, my idea was if you're vacationing in any of these countries, you're still supported. That was
Oh,
the idea.
absolutely. Absolutely. So what we can do is if let's say, um, so we are a fully Canadian company and our Canadian offices are totally separate from like oh, sorry, Australia is one of them. Our counterpart in the other countries, right? But what we can do is if you give us notice ahead of time, we can connect you with a local office of Right at Home, let's say in Australia, or if you're going to England, and we can facilitate that smooth transition. That's not an issue at all.
Thank
We've
you.
also had some
Thank you.
cases where our clients bring their caregivers outside of the country. But you know, just requires a little bit of just a little bit, just enough notice, just so we can ensure one that they have their passports, you know, and all of that that's needed to travel.
Thank you.
You're welcome.
Somebody has their hand up. I can't see who it is.
I think it was
Deepak.
Okay, he had his hand up. Okay.
Thanks, Deepak.
Any other questions?
I have one, if you don't mind. Rica, you mentioned the disability tax credit. I'm just trying to understand, how would that be obtained or initiated? Would that be through the family doctor having to fill out a form, or is there some other way?
Yes, typically it is through a family doctor.
Okay.
I'm trying to, I think a nurse practitioner can also complete it.
Okay.
However, the most common route is through the general practitioner and also a specialist. So I can speak from my experience with my daughter. We didn't go through our GP, but our endocrinologist completed the paperwork. So if you have a specialist who'd be willing to complete that, that would work as well.
My parents, when I started helping them with their taxes, they had already, I guess, gone through that process. So I don't know how they initiated it, but they were eligible for it when they were doing their taxes
Yeah.
each year.
Yeah. And also, if you're eligible for the DTC, you can also open RDSP,
Oh,
Registered Disability Savings Plan.
okay.
Why do people go outside the country for caregivers?
Some people are either vacationing for a longer
No, on
time.
a permanent basis. Like they end up sponsoring them and then bringing them to Canada, and then they're the home caregivers for them for whatever
Oh, I
year.
see.
How
I see.
does that work? Yeah.
So we don't facilitate that. Most of our caregivers are either locally within Canada already or they have their working permit. Um we do have a caregiver shortage in Canada. That's one thing. And I guess the benefit of sponsoring someone, like if they already are familiar with that person, that's, this is just a pure speculation why they would sponsor someone to come into Canada. But because we have a shortage of caregivers in our country, there is actually an immigration program that would pave way for caregivers to come and temporarily work here.
Okay. All right. Any other questions for anybody before we end? You can unmute if you have questions. In
Just
case
a
you don't know how to-
comment.
Yeah.
Just a comment. This medical expenses being tax deductibles may sound very rosy, but actually you don't end up having much, because you subtract 3% of the net income from that amount, and then 15% of that is non-refundable tax credit. So it really doesn't amount to a lot.
Yeah, the government catches you one way or another.
Yeah,
Not only that,
that's what I wanted to say.
yeah,
Yeah, that is also, that's very true. Although there is, so not all provinces have, similar programs, but for Ontario, we have the Ontario seniors tax credit, and that can be utilized alongside METC. So that might offset, although that was income tested, of course, but if one qualifies, it's something that you can claim alongside METC. But I would consult best with the accountant.
That is regardless of the medical.
Correct. Yes. So if you're already filing for METC, and you qualify for the Ontario Seniors Home Credit, I think that's what it's called, you can claim up to, was it $6,000 up to $1,500 credit annually.
As far as the caregiver credit that you were talking about, I know in the States, if a family member is a caregiver, they get paid for it. Is it the same in Canada, or that hasn't come into Canada yet, that a caregiver can be a family member?
So with regard to that, I know, so I'd have to verify this, but I know in some self-managed programs, so in self-managed program, the government gives the money to the family to manage on their own, but you'd have to, do all of like your taxes, payroll, and all of that. And if I'm not mistaken, you can have a family member, but I'll double check because I'm not for certain. We've had clients who engage us in that setting. However, they engage us as a provider, so they practically just, engage with us, and then we submit all the receipts and everything because we do our payroll and everything. But that's something to look into. I think it's called self-directed care or self-managed care. They change their name constantly, so I can't keep up.
Yeah.
For what it's worth now, I couldn't find any caregiver. I heard talk about it, but I couldn't find any actual place in the income tax to claim a caregiver credit when I was looking after my mom. So
Used to be a long time ago, not anymore.
okay.
A long time ago when we were doing manual income tax return.
Okay.
Everything has changed. But yeah, they used to be. But I know in the States they do. You can claim it if you're a family member. Hopefully it comes in Canada, but
Interesting.
yeah. Any other questions? Anybody at all?
I just wanted to make a comment, Bruno, here on
Yes,
the
Bruno.
disability tax credit.
Yeah.
It's one of my pet peeves. I used to
Oh.
run the Parkinson support group in Mississauga, and many of our members found that doctors are very reluctant to sign this form.
Heard
They're
that.
afraid they're going to lose their license, et cetera, et cetera. So if you really think you need it and you really think you qualify, you have to push the doctor to sign it. You want to make sure that the person you're looking after, when they go see the doctor, that they're not necessarily at their best. So if the person walks in, the doctor says, "How are you today?" and he or she says, "Oh, I'm fine." Doctors, their antenna goes up. So what I'm saying is, it's definitely worth getting. A lot of people are eligible for it and should get it, but the doctors are reluctant to sign it. So you have to advocate strongly if you want it.
I have to agree with that. And oftentimes it also is about the paperwork, because it is a lengthy paperwork to complete. And some physicians do charge, a set amount just to complete the paperwork. I would say if you're, like engaged definitely with your general practitioner or family doctor. But if you are seeing a specialist, specifically for your condition. So as an example, if it's Parkinson's, if you're seeing your neurologist on a regular basis, I would approach them as well, because in our case, like I said, it wasn't our GP or pediatrician who completed it. It's our endocrinologist. And we were so new with everything that I wasn't even aware of DTC. And when they gave us the form and they were like, oh, you should be applying for this. And I was just like mind blown. I mean, it's advocacy, right? So it really just depends on the physician. But I definitely agree with that. We all have to advocate for one another. So if the GP is not too inclined in completing the DTC form, seek out other professionals like your specialist, to see if you may qualify, because it is, it's a tax credit, right?
Yeah. Even when you have CCAC coming at home and assessing, they'll give you ideas. This is what's covered. This is what's covered. But there are things that are still covered. They won't talk to you about it. So you should try and push it, to see why is this not covered. So don't just give up. When they say this is all that's getting covered, don't give up. Push it. Push as much as you can to find out what else is covered. That's just a tip.
I think I'm going to hire you, Nazma, if I need some advocacy.
Looked
You
after my
inspired me,
mom, so I had to
Nazma.
go through a lot of things when I looked after my mom, and getting therapy. What do you call it? The therapy. The person would come at home and tell you, to make sure you put the rail here so you don't fall down. Occupation therapy.
Occupational
Yeah.
therapist,
So
yeah.
she had come and did that, and then with the CCAC and the PSW, they were limited as to what they could do. So I got the occupation therapy saying, hey, my mom is 86 years old. She fell down. You need more physio. So they ended up training the PSW to do it. So you really have to keep pushing and not accept just a no. So.
Very good.
Great.
All right. Any other questions? All right. I guess.
Well, Rica, thank you so much for this informative presentation. We really appreciate the time you took to come and talk to us today. For everyone, folks, I just make a reminder, there'll be a survey. There should be a survey today at the end of the meeting when you leave. We got our things working together, and I'll give you guys everyone a heads up when the recording of this meeting is posted. Rica, did you have any post meeting documents that you were able to forward to us?
Yes, definitely. I was waiting for the questions to see, like, so I could send it all at once.
Okay.
But my takeaway from this call is that I'll send you a copy of the slides, a copy of so it's funding options for home care. We also call it ways to pay guide. So I'll send a copy of that. We have one for different provinces. I'll send you the Ontario based. And I think I have a deliverable with regards to costing for Sensi. So I'll send that out. I'll find out our GTA pricing. Am I missing something else? I only have those three in my list.
Anything
I think that will
that's
give us lots to
applicable
read.
to Ontario.
Sorry, say it again, please.
Anything that's applicable to Ontario,
Sure, I
like
can send
Toronto,
some.
Ontario.
Mhm.
That's covered here.
Sounds good. So the ways to pay guide is actually a very comprehensive list.
Yeah,
That's specifically just for Ontario.
right.
So I'll send that over, and so you have that information. If something else comes to mind, please reach out. You can reach out to Colin
Yeah.
or
Who
Nazma.
do we contact you if one day we need to contact someone there?
What would be your preference, Colin or Nazma?
Well,
I'm
if you,
okay with anything.
It depends on what your requirement is. If something to do with the questions that to follow up on the Zoom, fine. If you need their assistance in your own personal life, then you get in touch with them, which Rica is going to give us the information to get in touch with her.
Yeah, okay.
But, yeah.
That's what I'm asking.
Yeah, yeah.
Sounds good. Yeah, I'd be happy to connect you with our care planners. We have, like I said, 57 offices. So depending on where you live and where the need is, I can happily connect
Yeah,
you.
well, I thought we said within the Toronto area, Toronto and the surrounding area.
For sure, yes. But we have several offices just within the GTA, so I'll make sure to connect you depending on the specific postal code.
Well, I
Mm.
think there's, yeah. I
Yeah.
mean, I think there's more than one we need to get in touch with.
Yep,
We
no
don't
worries.
all
You
live
can
in the
you can
same
keep me.
area.
Yes, no worries. You can keep me, and depending on the need, I can connect you with the right
Yeah,
person.
we need someone to, yeah.
I'm
sure.
usually pretty quick in getting back to, right, Nazma?
Oh yes, definitely,
So
definitely.
I'll try my best to respond back as swiftly as I can.
Thank
you
you.
so much, Rica. We really
Thank
appreciate it.
you.
Thank you.
All right,
Thank
have a
you.
wonderful day, everyone. Thank you.
Thank you. Take care.
Take
Take
care.
care, everyone. Thanks for joining.
Bye-bye.
Thank you. Enjoy your weekend.
You too.